I'm Dr. Monique Gary. I am a breast surgical oncologist in the St. Luke's University Health Network. I'm also the Chief Medical Officer for BEXA Inc., which is an early detection service delivery organization and startup company.
Fantastic. Thank you. All right. So now the interview shall begin. So, Dr. Gary, thank you for joining me. I appreciate you. Tell me a little bit about yourself and your work.
Okay, yes, thank you for having me for one. But I am a breast surgeon. I've been in practice for over 12 years now, and I'm in the Bucks County area, so Philly native. Went
Mm-hmm.
to Florida A&M, a Rattler. Hey,
Hey.
and I came back to this area to start a breast cancer program, which I did at Grandview Health. It's in Sellersville. And I'm a breast surgeon on staff now with the University, St. Luke's University Health Network system. So I get to take care of breast cancer patients. I'm involved in the imaging, the diagnosis, the conversations that happen, clinical trial recruitment, surgeries, and then survivorship. In addition to that, I'm also the chief medical officer for BEXA, which is a startup company that is involved in early detection for breast cancer. We have
Mhm.
a non invasive, pain free radiation delivery model for breast cancer early detection, utilizing AI techniques as well and some of the modalities there to really expand the way we think about early detection. The last thing I do is I'm also I'm the CEO and
All the
founder
things, right?
well, this part kind of matters too because it marries
Mhm.
all the stuff together, right? So I'm CEO and founder of Still Rice Farms and Foundation, which is a 40-acre farm for integrative wellness here in Pennsylvania, where we focus on meals, movement, mindset, and how it impacts the medicine from a scientific, science-backed approach. So we try to bring it all together for people who are battling cancer, chronic illness, help them understand the tools to live a better life, not just diagnose and treat disease, but focus on wellness.
Wow, that's wonderful. And I love that it's such a holistic approach to treating the whole person and not just trying to, target the cancer, get rid of the cancer, and then, you're leaving somebody, to fend for themselves as far as how they get to that complete place of wellness. So I really appreciate that work that you're doing. You talked about Bexa using AI. Talk a little bit about how that works in the company, how you're seeing AI use happen and unfold in the work that you're doing.
Absolutely. AI is expanding everything we're doing in early detection in general across the
Mhm.
board. But it is largely focused on how do we optimize existing technologies and make them smarter, faster, less operator dependent? How do we help radiologists where there's a shortage of radiologists? So you're seeing a lot of AI in mammography. Right. So early detection that looks at how can we help these mammograms not only find cancer today, but predict that cancer could
Mhm.
develop. And so it does so through using large volumes of information, right? We want to validate and train these AI models to understand, where are the predictive areas based on things like breast density. In BEXA, we utilize a different type of technology called elastography, which is looking at the stiffness of breast tissue rather than just the
Hmm.
density. And it's nice because this is something that is helpful for young women who were always told of dense breasts, right? Younger women are the fastest growing population of folks getting breast cancer, but the mammograms are based on density. So it's like looking at a cloudy sky looking for a cloud. And so you want to be able to find technologies that can help women who are pregnant, who are young, women who, all walks of life, and people who avoid that one thing that could save a life. There's a lot of
Right.
people who won't do it. And so we utilize AI in a lot of what we do. We partner with MIT, and we're very sensitive and thoughtful about how can we improve the sensitivity of our device to detect normal masses versus concerning masses, because we find masses. That's what we do. We
Yeah.
find masses of all kind, and then we send you to the doctors you need to get to when those masses are more suspicious. But can we predict those masses that are more suspicious? Can we help to train community health workers in countries where there's an underabundance of trained healthcare workers to do this work? And so
Right.
we use AI for a lot of those reasons to help us get smarter and faster and help the clinicians and not replace, but expand the landscape of early detection.
That is the key, not replace. You hear that, people? We still need humans doing this work, but AI is a tool. As I've always said, it is just a tool. Now, speaking of, you reached out to me. You left a comment on my LinkedIn post when I linked the digital twin story for Now and Next through Technically. Talk to us a little bit about how you see digital twins maybe helping in the future, or if you think they will help at all.
I love this because at my heart, I'm a researcher, right? So
Mhm.
I'm a cancer researcher in my day job, and I'm always talking to folks about clinical trials and getting involved. And digital twins is something that is here to stay. I was just in New Orleans at the Young Survivors Coalition talking about AI, and one of the topics that came up was this concept of a digital twin. It's important for us in cancer research, especially, to be
Mhm.
able to try things out and learn from, but not at the expense of the individuals.
Right.
So, meaning, right? Cancer, when you think about cancer, everybody says, okay, am I going to die? Do I need chemotherapy? Right? And what types of drugs? And how do I fight this naturally? Well, we can refine those drugs and we can get more precise when we can create these digital twins that say, okay, let's test out how this is going to respond in women who are 50 years old, who are postmenopausal, who have this stage
Mhm.
of cancer. We create that computer model and then we can test things against the model. And so it is very helpful for us to look at how we can expand both the depth, the breadth, the speed of research through these digital twins. But there are some pitfalls that we should, talk about as well.
So you're actually using digital twins as a concept now to sort of test out therapies and treatments, but you say there are some things that we need to be thinking about. What are those things?
It's true, and companies are using it more and more, and our pharma partners, et cetera, our clinical research organizations. But the things we have to be mindful of are, number one, perpetuating disparity. Right.
Mm,
So a model is only as good as the population is validated on,
that
right?
part.
There you go. I can feed you information on shoes, but if all the shoes are high heel red bottom shoes, and now you want to know about sneakers, well, you can't say, well, we got, thousands of shoes in our database, so we can tell you all about that shoe, right? There you go.
Come
You're
on,
clocking
you
those
you
T's.
preaching right now, Dr. Gary.
And so I just want to be really careful because these companies are looking for workarounds for shortages. And what is there a shortage of? Black and brown people in clinical
Yes.
trials, right? We're always like 2%, 1%, 3%. And the reasons have a lot to do with not being asked and invited to those trials.
Hmm.
It has to do with our comorbidities and our existing health challenges, which is kind of what we focus on at the farm. How do we get ourselves healthy for a trial? But
Right.
I don't want companies to think just because we have some of the molecular and some of the things that we think make up the black woman, now we don't need to recruit these black women into trials. It's not a replacement, right? Can you test it out on the digital twin so that it's a little less toxic?
Right.
Absolutely. I love
Exactly.
that. Go for it.
I
But
would
do I
also
want
say, though, too, we need to encourage our community to be more willing to participate in these trials as well. Because I think, that is, I can recall a time or two when, I've had family members be asked while they were in the hospital, like, hey, do you want to actually, and I mean, I know there are a lot of different reasons that we would be skeptical about these kinds of things,
sure.
but we also have to, it's like lotto, you got to be in it to win it as well. So I would just put that out there for anybody watching this. Like, if you do get that opportunity, you or one of your family members, ask as many questions as possible. Listen, use Chat GPT to get a list of questions to ask a doctor about a clinical trial and what that all entails. And if it makes sense for you, you may want to consider it, because we do need that data so that we don't get left out of these processes.
And you're absolutely right. And that is the take home message from this whole conversation, is that none of this is going away. And we have to be at the table so we are not on the menu, right? It's important.
Girl, you
And
dropping gems right now.
so, I mean,
I love it.
listen, I cannot stress this enough to women and men and everybody. There's trials for everything, not just drugs, first of all. But we got to be involved. If we want medicine that's more precise, if we want wellness that's more, if we want anything that's more precise, you can't personalize medicine to a genome you don't have,
Mm,
right? And so
yes.
we want to make sure that we're not just saying, oh, all the silverware in the drawer when we only study the forks, and the
Right.
knives, but not the spoons. So we have got to make sure that we are counted, involved in these trials, because it is going to help the science be more precise. It is going to help the treatments be more precise, and it's going to impact all of us because we're always the ones who are diagnosed with the latest stage, most aggressive things.
Yes.
And so if we want that to change, we got to be involved.
We got
Absolutely.
to be a part of the solution and not the problem. Absolutely. Last question. What are there any other sort of AI innovations in medicine that you are excited about or something you'd actually want to see out there?
Oh, I love this question. So, yes, I am excited about AI innovations in integrative wellness, right?
Ooh.
We focus a lot on precision oncology and precision treatment, but what about precision wellness? And so
Mm.
myself and many of my colleagues, we are working actively towards developing tools that can help people with their various health challenges precisely target their goals and their metrics, right? Because the AMA will say, great, you need 10,000 steps a day. That's what we recommend. 30 minutes of exercise a day, right? 10,000 steps.
Right.
What if you can only take 500 steps? How do we get you from couch to 5K?
Mm.
And where's the prescriptive regimen for that based on your cancer diagnosis, where you are in treatment, based on your comorbidities, based on all those things, right? And so we can be precise in wellness, reducing risk for cancer recurrence, and helping to optimize people for things like clinical trials. Because the other reasons we don't necessarily get involved in them is that we're not the healthiest of the sick. We got too many diseases and comorbidities and kidney disease, diabetes, this and that. So
Right.
we optimize our community to even be able to get more involved in things like clinical trials. So I'm excited about precision wellness. It is coming, it's here now, and
Hmm.
it's not a luxury though. Like it's a right. Wellness and good health is a right and not a luxury. And AI is going to help us to expand those tools, expand that research, expand that access to everybody.
Expand that access and expand that equity. I love it. I love it. I love it. Dr. Monique Gary, thank you so much for talking to us. This will not be our last conversation. So get ready because I will be reaching back out. But thank you for this. I know our viewers are going to appreciate this add on to Now and Next from Technically. Stay tuned. We got more good, yummy tech goodness coming soon.
Thank you so much.